Hey folks, it is Friday, June the 10th. It's been several weeks since I've talked with y'all, so even though I'm taking a leave day today, I felt kind of guilty for not talking with you, especially with some of the things that I needed to bring folks up to date on. So anyway, um, I looked back through my notes, and actually, I think the last video I did was May the 20th, and then there was the Memorial Day holiday, and that was a break for me also. And then, of course, there was the tragedy around Latta on that Friday, which was the 3rd, was the funeral visitation for Tim Brown. And I was in attendance at that. And many of us were also in attendance at the funeral. I think by now all of you probably know about this tragedy, the unnecessary death of our nurse practitioner in Latta, Archie Tim Brown. We called him Tim. I think he might would, you know, box somebody's ears if they called him Archie. Such an unnecessary and truly tragic event that has just rocked us, Latta, all of us, to our core. Tough, tough, tough week. So, yeah, wasn't any video last week. Out of this tragedy, though, I there will be some things. We'll do some memorial recognitions, portrait, etc. in Latta. That'll be special. Tim was so loved by his coworkers and his patients, so that'll be a nice legacy. But we're also doing something else. Through the generous donation of Care First, we are starting a scholarship, a nurse practitioner scholarship, the Memorial Archie Tim Brown Scholarship for nurse practitioners. We don't have the details yet. Care First has just started us off with the money. We'll be doing some additional fundraising, and we've got to determine the criteria and expectations from it and so forth. But I'm really excited about that. His family is also. This is the type of thing that will be a legacy that will live on, will impact many, many, many people, not only the individual who receives the scholarship, but all of those that that individual serves in their service as a nurse practitioner. It's going to be hard to find nurse practitioners like Tim Brown for this scholarship. He was very special, very, very special. So it really is a great pleasure to be able to roll out this scholarship as a legacy. Uh, Gun violence is a public health emergency, and it's been declared this public health emergency. Before COVID, gun violence was the single most highest contributor to premature death across the nation. It is a serious, serious issue, and it's a public health issue. So we'll have to see where the future leads us on this. There are several national and international organizations that are taking on gun violence and what communities can do in response to it. And maybe this will also have some traction at Care South as we look at what are some of the ways that healthcare can address gun violence. I don't know the answer, but it is definitely an issue that we need to have on our radar screen for the health impact that it has. So many lives are adversely affected. Just a few little updates in terms of calendar things. We're having the Dillon Building ribbon cutting on Saturday. That's pretty exciting. This is a really breakthrough event, and a breakthrough building, a breakthrough service, having a combined effort between a Department of Health and an FQHC like we are, and collaborating to coordinate and provide a whole array of services together. That ribbon cutting is going to be very exciting. Folks from DHEC are really excited to be participative, and we are too. Looking forward to that. And we haven't forgotten some of the others. Chesterfield is on our radar screen. As a matter of fact, next Thursday, we're doing the Chesterfield ribbon cutting. And you probably say, well, Chesterfield's been moved into their building forever. Unfortunately, they moved into that building during the height of COVID. So we're just now beginning to get around to our ribbon cutting ceremony. And that's a very nice celebration to all the services that are new and exciting for Chesterfield: pharmacy, radiology, dental. So exciting things happening. I hope to be able to soon announce that we'll be having a groundbreaking at Chirral. Things are beginning to get underway at Chirral, and I'm hoping that we'll have some good announcement around our next big project, which is the St. David's project, the renovation that we'll be doing at that building in Society Hill, and being able to accommodate a significant need for administrative space. So stay tuned for all of that. I'll close briefly. It wouldn't be a video if I didn't talk at least briefly about COVID, but frankly, I know you're sick and tired of hearing about COVID. I'm sick and tired of talking about it, but we have a responsibility as healthcare providers. COVID is having an impact. They have called the last several weeks one of the highest surges, second only to the very high initial Omicron surge. Uh, and we feel it at Care South. We've had a increasing number of employees on quarantine, sick and on quarantine. On quarantine, some that are asymptomatic, but nonetheless on quarantine and not able to work. So we see that impact. When you look at the CDC transmission rate map, and remember, that is different from the community level map. I'm going to give you a link in the email on how you can find that map on the CDC website. All of our communities around us are red. As a matter of fact, most of South Carolina is red. There's only one county, I think, when I last looked, that was yellow, and only maybe a couple that were orange. So, there's still a lot of virus out there. The numbers are hard to count because of home testing, which those test results aren't reportable. But the other factor that goes into the CDC transmission map is the rate of positivity. In other words, for those tests that are done and are reported, what is the rate that they come back positive? And that has been on the increase too, anywhere from 14 to 17% positivity rate, and that's a big concern. So that's why CDC says transmission rates are still in the red. My main message is, when in doubt, test. We got plenty of those home test kits, and we're going to be ordering more. Feds are making a lot of them available to us, and we're going to take advantage of that. I know it's called stockpiling, but hey, you don't know what's coming down the road, so maybe we need to stockpile. But when in doubt, test. Don't assume that it's just your allergies. I've had at least two or three people say, "Well, I thought it was my allergies," and it wasn't. It wasn't. If you don't test, you think it's your allergies, you're going to be out there spreading the virus. So, when in doubt, test. I also know that you're so tired of change. Change, change, change. Do we wear a mask? Do we eat in congregate settings? What do we do? And I'm just tired of it too. And it's frankly, it's hard to keep up with. I can't. say anything except we have to be compliant with what CDC says. So, when they change things because of the rapidly changing virus, then we have to become flexible. And folks, this may be how it is on an ongoing basis. So I'm afraid that this is going to be how we manage in the future, being nimble and being ready to change on a dime. Last point, we now have the word from the Joint Commission that their visit with us will be on site. We were kind of having our fingers crossed that maybe it would be virtual because of the transmission rates, but no, they confirmed with us this week that they were planning on coming out to us and that we were on their schedule, which means that we can pretty much imminently expect, and I don't know what imminently means, next week, next 2 weeks, next month, the Joint Commission visit. Stay on your toes. Uh, we'll get it over with. Whatever needs to be fixed today, fine, we will fix. This is an important part of who we are. Being Joint Commission accredited as an ambulatory organization and then certified as a patient centered medical home is important. And we really thank everyone for doing their absolute best. Don't be afraid. We'll work things out. Well, y'all stay safe over the rest of the weekend. Enjoy it. I think we're going to have some good weather. I'm sitting outside right now listening to birds chirp. Y'all too, take some time, get some vitamin D, but above all, stay safe. Take care. Bye bye.